everybody, welcome to the channel. This is Dr. B, Dr. B360 at Dr. B360 Official. Let's get started. The topic today is an important one. We've been covering some stuff on benzos in various forms, and today we want to discuss benzodiazepine withdrawals. In particular, I want to delineate, separate, and lay out the difference between what we can call acute benzodiazepine withdrawals and what is called chronic withdrawals. Another term for it nowadays is post-acute withdrawals for benzodiazepines. Usually the acronym PAUSE, a term usually reserved for opiates, but now in addition to opiates, it is applied to benzos. There's also the term protracted benzo withdrawals. These all apply to the same phenomena, and we will call it chronic or protracted benzodiazepine withdrawal. That is it. We will talk about two different and only kinds of withdrawals associated with benzodiazepines. One is acute or short, and the other one is chronic or protracted. Why is this important? I think this is critical to differentiate between the short-term benzodiazepine withdrawals and long-term protracted benzo withdrawals, what that means for the patient, and how the medical establishment and providers view the difference between these two types of withdrawals with benzodiazepines. This is important. Patients and medical establishment, two different perspectives. Why this matters, you need a framework to conceptualize all of this, okay? You need to see the big picture, then you will understand what is happening better to you or your loved one or your friend. You will also understand how doctors and the medical establishment see it. This will create for you better communication, more effective communication, and ultimately you can make better decisions for your health in regards to this issue. And many people are indeed suffering. Many people are lost. Many people are scared. And there's miscommunication and mistrust in this area. Recently, I did a video on when is it appropriate to utilize anti-seizure medications for benzodiazepine withdrawals. Check that video out. That was in the last couple of weeks. And we got a little bit of the discussion that overlapped into this discussion. That helps a little bit, but now we're going to dig deep and really focus on these two types of withdrawals. Let's get started. As I have said previously, benzo withdrawals for the established medical community are the acute and early ones. That's the only type of benzodiazepine withdrawals that they formally recognize for the most part. It is a clinical entity that we as physicians understand and treat and have extensive literature and protocols on. In fact, this entity falls under the umbrella of emergency medicine doctors who should be very well versed in benzodiazepine withdrawals, the acute kind, and managing it quite elegantly if the physician is well versed in this art and has had a lot of experience. It can be extremely dangerous and can get you very sick, like ICU and intubation sick. So it is an important clinical entity and syndrome for physicians to understand, and the physicians that should understand it best is emergency medicine physicians, because they see it and it's part of the toxidrome umbrella of ailments that they treat. This is what doctors will understand in general, all doctors, if you are talking about benzodiazepine withdrawals. And if you speak to an emergency medicine physician who's treated many of these, he'll really understand. But when you say benzodiazepine withdrawals, this is what pops into a doctor's head. And if they're far away from these kinds of things, you are certain that nothing else will pop in their head, and this will even pop in their head only in a conceptual way, not in a clinically immersed treatment way. Acute or short-term benzodiazepine withdrawal symptoms do not, again, I repeat, do not last more than, at most, for the most part, a week. I've mentioned this in previous videos. Plus or minus a few days. Again, it's always a spectrum. They can begin within hours, maybe up to a few days after stopping the offending drug, depending on the half-life of the drug, how long you've been on it, what your dose is, and what your particular physiology, pharmacology, pharmacodynamics, pharmacokinetic makeup is, and your genetic predisposition and other underlying considerations which the physician would consider, but that will determine if it even begins, if it's going to be in a few hours or in a few days, 2 to 3 days. Let's break that whole complex of presentation of acute withdrawals to early symptoms, peak and severe or complicated withdrawals, and as it is always a spectrum and everybody is different, okay? So again, we're going to break it down to early symptoms, peak symptoms, and severe or complicated. 3 things: early, peak, severe, or complicated, okay? Early withdrawals, usually 6 to 48 hours, okay? So a few hours to a couple of days before they even begin, if they begin for you. These symptoms include anxiety. It's really a rebound anxiety that's probably worse than the person's usual anxiety. Insomnia, being more irritable than usual, having more mood swings than your baseline, if you have any, being restless, agitated, mild tremors, mild shakiness, especially of the hand. And it could be apparent when a physician takes a close look at your fine motor movements, depending if they are well versed in this kind of thing or they are not. Okay? What is called fine motor tremors, early withdrawals, usually begin 6 to 48 hours after the person stops the benzodiazepine. Okay? So a few hours to a couple of days. The symptoms can include, this is for early withdrawals, some anxiety or really rebound anxiety, and it's usually worse than your usual baseline anxiety. Insomnia, being more irritable than usual, having more mood swings than your usual baseline, being restless and agitated, having some mild tremors, mild shaky hands, could be apparent when an experienced physician takes a look at your fine motor movements, which could translate into what is called fine motor tremors. There could be sweating, increased heart rate, increased blood pressure, some muscle stiffness or pain, sensitivity to light and sound. There could be some nausea, loss of appetite. These generally fall into the early withdrawal time period, 6 hours, few hours, plus or minus, to a couple of days. Now, we get to the peak symptoms, and that's somewhere between 2 days to 48 hours to a week, okay? 2 days, 48 hours to a week. This could include anxiety, which is worse, panic, which is worse. Now you start getting some depersonalization, derealization. These are psychological terms. Simply put, they mean feeling of being detached or unreal or away from your body. There's hyperreflexia, right? Your reflexes are hyper, which can actually be debilitating if they're really bad, and you can have difficulty walking and doing some fine motor stuff. And some of this the patient may or may not notice if it's mild, but if it's much more exaggerated, the physician can do a little bedside testing, hammer testing to see what these are. The tremors actually start to worsen from that early period during this peak period. They might be visible and apparent without much evaluation at this point in the peak period, depending where you were in the early period. The person can also have worsening nausea, vomiting, dry heaving, severe headaches, worsening of sweating and chills. All of this has increased over the last couple of days, including muscle twitching and jerks, difficulty concentrating now, which in the benzodiazepine world often called the brain fog, okay? They can have perceptual distortions, visual distortions, in general feeling dysphoric, feeling off balance, okay? We're talking about the mid-cycle of that early or acute withdrawal with benzodiazepine, where a person stops a drug, and this goes, we're talking for the first about week, okay? Now we are going to talk about, in the first 48 hours to a week, a lot of these symptoms are the same as the early withdrawal symptoms, but they're much more escalated. They're much more exaggerated. And then you get into severe, complicated withdrawal symptoms of acute benzodiazepine withdrawals. These could be anywhere from 3 to 7 days. Again, don't take these numbers as solid numbers, right? Everything blends into the other one. We went through early, we went through peak. Now we're saying 3 to 7 days loosely. And this is where the bad stuff happens. This is where you can get really sick. This is where you can get ICU sick, intubated sick, okay? Not that the early stuff doesn't suck. Just ask a patient. They do suck, but this period is really frightening even to some of the caretakers and nurses that do this often. This period includes the famous seizures or potential for seizure. And this is especially true when there's an abrupt discontinuation of the drug, when the drug is in high doses. I've also noticed it, and I think it's in the literature, where you will see this if the offending agent are short-acting benzodiazepines. That includes Xanax, that includes Ativan. I don't think everybody knows Ativan is short-acting benzodiazepine relatively. This period can also get into hallucinations. They could be auditory, hearing things. They could be visual. Doesn't mean you can't have sensory on your skin like tactile, but again, there's trends. You often see the kind of tactile thing with methamphetamine hallucinations, not with benzos. With benzos, you see, like I said, auditory and visual. There can be paranoia. They can have delusions. They can be disoriented, very confused. And sort of the end of this spectrum is, which you already know, it sounds like that, DTs, delirium tremens. Severe alcohol withdrawals, right? Don't a lot of these symptoms sound the same as alcohol withdrawal? Well, as I've always said, benzodiazepines are, for the most part, alcohol in a pill. And this is true in a real sense. Alcohol in a pill. And so it only makes sense that DTs are included. And DTs include agitation, fever. They can get really high fevers, profuse sweating, severe hallucination. And again, these seem to be worse and more pronounced and happen more often. People that use short-acting benzodiazepines, and these include Xanax and Ativan. A lot of people, as I said, don't know Ativan is a short-acting benzodiazepine, but it is. So that is acute benzodiazepine withdrawals. Generally speaking, it's just benzodiazepine withdrawals in the medical clinical world. No other withdrawal is either known to them or recognized. Nowadays, a lot of physicians are aware of or have heard of, depending on what field they're in, of chronic benzodiazepine withdrawals. But, for the most part, if you just walk up to, especially ER physicians, they know short-term withdrawals. They know benzodiazepine withdrawals as everything we've described, and they're pretty good at managing it. Now, without going into too much detail on the history of protracted benzodiazepine withdrawals or chronic withdrawals, it has never really been recognized even to this day by the medical community, okay? But there are some changes now and some evolution. This matters because I want you to understand, if you walk in and tell a doctor about what you're going through, they may think you're nuts at best. And they really do not understand what to do, even if they wanted to help. And not knowing what to do actually makes physicians quite uncomfortable, right? And sometimes, you know, there's sort of a projection kind of a thing going where a physician may even turn around, blame you or fault you for your presentation because they may not understand it or they may not know how to treat it, and doctors don't like that. So we're talking about this more creepy, evolving clinical entity of chronic or protracted benzodiazepine withdrawals, which seems like a few more physicians are recognizing it. There's some literature coming out on it, and at this point I'm pretty well versed in this and have managed many patients at different stages and places in the spectrum and timeline of protracted or chronic benzodiazepine withdrawals. Let me break the symptomology down system-based in terms of pathology or pathophysiology. Okay, let us start off with the cognitive symptoms or the neurological symptoms. These can include brain fog, okay, persistent difficulty thinking clearly, concentrating, focusing on tasks, memory issues, short-term memory problems, forgetfulness. Again, you get depersonalization and derealization, which is consistent sometimes. Other times, for other people, it's recurring, comes and goes. There is no boundaries on the frequency or how bad it is, right? Sometimes certain things are even gone for weeks, months, and even years, and they pop back, comes and goes, whether it's this set of symptoms or any of them. And for some, there might be there all the time. People often have describe weird sensation often in their head. They call them brain zaps, head pressure, tingling. They feel full in the head, quote unquote. Again, hypersensitivity to stimuli. It might be bright lights. It might be sounds. It might be crowds making you feel overwhelmed, dizzy, off balance, vertiginous, okay? Maybe motion sickness feeling, and as I said, the vertiginous, tinnitus ringing in the ears, okay? You get the whole constellation here, okay? And there's one more I want to add in this space. I'm going to call it a neuropsychiatric symptom, and we're going to get into this and some other things maybe in some other videos, but it's chronic akathisia, not the kind from being put on psychotropics or antipsychotics that's immediately treated with the drug for the most part, okay? This is chronic akathisia that goes on indefinitely, and this clinical entity is not often talked about, difficult to treat. Patients feel like they want to commit suicide, and it's described as inner restlessness or inability to sit still. It's much more than that. Don't want to get into it at this point because I want to cover my topics that I want to cover at this point, but I will say that it is there for benzodiazepine long-term withdrawal, and it's a neuropsychiatric symptom. Let's move away and get into psychiatric symptoms and just purely psychiatric symptoms. You can get chronic anxiety. They get a lingering sense of panic, sense of doom, sense of worry, unease. I call it, general dysphoria, right? There could be depression. There could be just simply a part of depression, lack of pleasure in things that they used to find pleasure in, anhedonia. They start to have intrusive thoughts, OCD-like symptoms, OCD symptoms, and these can be persistent. They could come and go. They could be there for a little bit to a certain extent and just change all the time. In short, they're all very distressing to the patient, okay? The compulsive behaviors on there, insomnia, emotional blunting, numbness. I've also even seen emotional hyperexcitability, and it's just a roller coaster in this area, okay? Let's move on and call the next system, you know, the autonomic nervous system dysfunction, dysautonomia-like features, your autonomic nervous system gone wild, okay? It's kind of gone to crap. Temperature dysregulations, feeling too hot, feeling too cold, sweating, flushing. Again, sudden episodes, comes and goes, maybe not, maybe persistent. Frequency, unknown, changes over time. There's no rhyme or reason to any of it. You can't measure the frequency of any of this stuff for most people. Heart palpitations, comes and goes. Changes in blood pressure. Feeling of air hunger, shortness of breath, shallow breathing. I put all this under autonomic dysregulation because they are regulated by the autonomic nervous system for the most part. GI symptoms, nausea, bloating, IBS-like symptoms, constipation, right? Diarrhea, again, IBS-like symptoms, gas. There's just a persistent discomfort of the stomach, acid reflux. That's just some of the GI stuff. Let's go to MSK, musculoskeletal, okay? Again, sensory symptoms, muscle pain, stiffness, constant twitching, burning, tingling, paresthesias, okay? As far as the pain and stiffness, they can have soreness, tightness, there's tremors, internal vibrations that they feel in their muscles, right? A feeling of shaking of the body. It's just uncomfortable, and it's just very ghoulish, the way these patients have to live. There's also fatigue, early exhaustion, muscle jerks, and so on. Inflammatory and flu-like symptoms, another system, okay? And then there's hormonal and metabolic, right? Where they get adrenal surges, right? Sudden rushes of panic, fight or flight, cortisol dysregulation, early morning anxiety, crashing fatigue, sexual dysfunction, libido, blood sugar swings. You know, they will have low blood sugar, okay? And going on with the flu-like symptoms, they get like, you know, they get this sort of like uncomfortable, achy flu-like thing, mild fevers, feeling sick randomly. They get histamine intolerance, right? And they truly get new allergies. I've seen it. I've seen them get allergy testing. They get food allergies, rashes, food sensitivities that they didn't have before, joint pain, stiffness. It's very much like a lot of the autoimmune conditions, and a lot of it is even like fibromyalgia. Okay, I'm tired. How long does all this last? Okay, and who gets it? Okay, who gets it? Let's just talk about the course and duration real quickly here. For the chronic benzodiazepine withdrawal, okay? Some last weeks to months. Some last up to a year, and some may go on much, much longer, okay? Triggers that make it worse, some of the stuff in the literature, and a few I've seen: stress, caffeine, alcohol, certain medications, and I would say they're very hypersensitive to especially psych medication, poor sleep, physical exertion. There's a lot of controversy around this, but I do know one thing: it is real. Now, it also, having this for a long period of time does lead to other chronic issues, which I don't want to get into here because we've spent a lot of time speaking of this very issue of the chronic withdrawals. But I'm just breaking down here short-term withdrawals, distinct from long-term withdrawals. Short-term withdrawals is in the medical literature and recognized. We know how to treat. Long-term withdrawals, still there's no formal ICD or DSM designation, and there's a different different mechanisms that researchers are proposing, like GABA receptor downregulation, but I don't want to get into those either. I would say these symptoms, as far as their frequency, how strong they are, how long they last, all of them are over the place, okay? All of them are all over the place. And I want to reiterate, part of these can often be mixed in with that one neuropsychiatric symptom that may sort of overwhelm all of the other ones, and you get confused with anxiety or panic with your chronic akathisia. This one is really a mother of them all, and it's sort of, to me, I don't want to say it is in some ways worse than pretty much all of them, but they also sort of crossbreed and go into each other's boundaries, okay? One last thing I want to say on this whole thing, this is very important. You also see this chronic withdrawal complex to various extents with people coming off of any SSRI or antipsychotics. I'm going to call it in general the psychotropic withdrawal symptom complex, the chronic psychotropic withdrawal symptom complex. And I'm going to leave it at that, but it's important for you to differentiate from the acute stuff. More importantly, hopefully some providers out there and other folks out there, we need to recognize it, validate for the patient, for their own peace of mind and sanity, that there is a long-term withdrawal issue happening here across the board with many psychotropics. How long does it last? I don't know, and I don't think anyone knows. And we do know if you've been on high doses of benzodiazepines for long periods of time, you're more prone to it. Short-acting benzodiazepines with short half-lives, you're more prone to it. And that seems to be the general deal. I may dig into the different aspects at a later time and discuss treatment issues and approaches to treatment. That was a lot to digest, but I feel like this needed to get out. If you had the attention span nowadays to get through this, or if you thought it was important enough, good. Don't forget, thank you very much for sitting through this. Like, subscribe, and see you guys next time. Thank you.